if you go to a place that's going to do labs on you and tell you your labs are terrible, you need to make sure that you look up the time those labs should be drawn, because a lot of these hormone clinics will draw your labs midday and then tell you, oh my gosh, you're so low. Well, there's during the day normal fluctuations.
Yeah.
And there are standard times that you're supposed to check those things. And if you're not checking at the standard time, it's always going to look bad.
Mm-hmm.
And we don't treat lab values. So if your hormone doctor is treating your lab value, they're in it for the money. They're putting a pellet in you that they're making some money off of or something, because we treat symptoms.
Welcome to the Juggling Life Finding Balance podcast, special edition of Sister Talk with Viv and Becca. I'm one of your hosts, Vivian Cummins, and I believe taking a few moments out of our busy day to enjoy some good old-fashioned fun is necessary for a balanced life. And that is what Sister Talk is all about. Becca Robinson, my co-host, was once my sister-in-law, and while we're no longer related by marriage, we are still the best of friends. Today, Becca and I have a special guest with us, Dr. Misty Bogle. Dr. Bogle practices family medicine at Blanchard Direct Health in Blanchard, Oklahoma. Dr. Bogle also owns Image and Soul, a cosmetic clinic and spa also located in Blanchard. Today, Becca and I are asking the doctor some questions, from sagging cheeks and skin cancer to herbal supplements and hormone replacement therapy. Dr. Bogle has the answers. So come on in and join us, and let's get started. Well, hey, ladies, this is so fun. Becca, we have a special guest today.
I know. I'm so excited. We've never had a guest before. Thank you, Misty, for being our guest.
Of course. Thanks for that great intro. I'm excited to be here.
Yes. Well, we are so excited to have you. And I would love it, Misty, if you could take a minute, introduce yourself to our audience.
Hi, I'm Misty Bogle, MD. I'm a family doctor in Blanchard, Oklahoma. I've been in Blanchard for about 17 years in different capacities, and I currently am self-employed in a direct primary care office as well as a cosmetic clinic and spa. That spa's been open since 2014, but the direct primary care for about a year and a half.
I love it. So we all have a special relationship. We'll just get that out there because we all know each other. We're all sort of Misty, I don't know. I don't think you and I were family when you came into the picture, but Misty, tell us how you know us.
So my husband, Ronnie, is Becca's cousin, and therefore the cousin of Vivian's first husband. And then when Vivian decided to rejoin the family, strangely enough, she remarried Ronnie's cousin from his mom's side, not her dad's side. So we just kind of got to be like double second removed cousins, something. And we're just delighted because we all love Vivian. And, you know, when she pseudo exited the family, everybody's like, "Aw." And then she's back.
She's back. We've talked about this on the podcast before, this family dynamic that we have. So I think people are familiar that we have a somewhat of a strange situation when it comes to our family. No one really ever gets out. Like, that's kind of the joke.
I know. I kind of feel like I pushed my way in, though. I mean, it's like, okay, I'm coming back. How can I get back in this thing?
Hey, it's a good family.
It is a good family. It is. And it's so funny, Misty. My husband, Eddie, he knows your dad. And didn't your dad, okay, explain that. Your dad had like a junkyard. Yeah. And so Eddie and his dad used to go out there all the time and get parts because, you know, Eddie builds things and vehicles and stuff like that. And it's just so funny to me because you're not that much younger than us, but he remembers you being this little bitty girl out at the junkyard. And that's how he sees you today. And I'm like, honey, she's a freaking doctor. She's a doctor now. She is not a She's not a little kid running around the junkyard. It's like, oh, good times.
Yeah, Eddie's dad used to drive truck for my dad, and he does junkyard, recycling center, depends on how, like, is it Target or Target you wanna be.
Mm.
But yeah, I grew up in the junkyard. My punishment would be to rake the junkyard of nails if I got in trouble. It was it was a it was a raising for sure.
Yes. I raking the junkyard of nails. So is it just going through the junkyard and finding nails and like picking them up or what? What was that?
Oh, it was like a 7-acre acreage of junk and
Oh.
old cars and all the things. And if you really got in trouble, my dad actually had a rake with my name engraved on it with prayer.
Oh
Yeah,
no.
I've always been very strong-headed. And so the front, probably 2 acres was asphalt, and that's where people would drive up to get on the scales and that sort of thing. And if you saw me out there raking, I had been too hard-headed, I guess, would be the right.
Um,
Well, I think
okay.
that it gave you great work ethic
That
because you
it did.
truly do have great work ethic.
Yes, I agree. Some of the
Hmm.
things that my husband, we'll have to have a show on that someday, bring him on. Some of the things that he tells me that his dad had him do, I'm thinking, wow. But you know what? Eddie too has some of the best work ethic of
Hmm.
anybody I've ever met in my entire life. So maybe there's something to be said about growing up in the 70s and 80s. Oh, well, Misty, we got some questions that we want to ask you. And so, if you don't mind, I would love to know, first of all, how did you choose the specialty in this medical profession?
So that's an interesting story that involves your relative probably more than anything. And I loved medical school. I loved every bit of it. Everybody, most people hate part of it, but it's just really deep, intense learning, and I love to learn. So I enjoyed every part of it, and I knew I loved everything. But I really loved surgery. Really loved surgery, and I was good at it, which sounds terrible to say. There are things about the operating room, the smells, the feels, the whole bit. I love being a junkyard kid, and you worked on cars, and you could see that you fixed something, and so you had a sense of accomplishment right there, right?
Yeah.
Mm.
So surgeons see a problem, they go in and they mechanically fix it, and then you leave, and they're like, "Yeah, I did that," right? So you have the sense of accomplishment. I loved it. Um, However, that work ethic we just described can go into pathology, and mine does most of the time. And so I love surgery so much that Ronnie came to me and told me that I love surgery more than I loved him.
Mm.
And emotionally, that's hard to hear. It's
Mm.
hard. And we'd been married at that time for about 7 years. Um, and I really reflected on it because he never complains. He's always incredibly supportive. And I really reflected. And I had to admit to myself that that was true, and that it wasn't emotionally true in my heart, but that's what my actions were gonna show him for the rest of our lives.
Mhm.
And the surgery program had a 120% divorce rate due to one guy being remarried and divorced again in a 5-year program. Um, and Ronnie was like, "Don't make us a statistic, like, you're gonna make us a statistic." And I was like,
Yeah.
"Oh, oh." So I cried for about 2 weeks, and it was right during interview season. I withdrew my surgery application, and I really thought back. I was like, who was happy? Who was happy? Who still had their family around them? Who was working into their 70s and 80s because they still loved medicine? And I was like, it's the family doctors. They're happy.
Mm.
And it's a broad enough field that you can make it just about anything you want to, as long as you educate yourself appropriately. And I knew I was going to forever be a learner. So I withdrew that surgery application and applied to 2 family medicine programs that were what's called broad scoped. So like they taught you could do C-sections, you could do OB, you could do hospital medicine and procedures in hospitals. So they were very intense compared to the easier way outs. Um, and ultimately ended up at St. Anthony's, and it was a wonderful program that had Christian-based values, taught us to um, monitor our patients if they had signs of faith being important to them, that you could include that in their healthcare, which is very important to people. And so it really helped me become what I think, I hope, a good doctor, but also a better Christian. And so I often say that my dedication to St. Anthony's for 16 years came on the fact that they helped take me from like a baby Christian to a more mature
Mm.
Christian, if you will.
I
Mhm.
love that. Becca, did you know
Mhm.
that? I did not know this.
I about the surgery?
About
Yeah, the
the
surgeon or
yeah.
yeah, Misty and I had this conversation one time at Family Memorial Day. It was around the time that you had decided that you were going through that. I remember you telling me how upset you were and how disheartening it was for you. And I've thought that through the years. I've often wondered if you've regretted not going into surgery.
I long for the operating room. And so I did a full scope OB, delivered babies and C-sections until about, I think my old youngest baby is 3 years old now. So
Mm.
about 3 years ago, I gave it up. And just because I live a little too far from the hospital,
Mhm.
and it got to the point where I was so pulled in lots of directions that I didn't feel like I was in it enough to stay good enough at it. And so I stopped about 3 years ago. I do long for the OR though, like the
Yeah.
smell of mastisol, which is what you use to put the little steri strips on, like that is the completion of a case and it feels done. So I do long for those things. I don't regret it because I do feel like I have a dream life. I have a really good life and it
Yeah.
was the right decision. And when I look back on the younger me, um sometimes I think, wow, kid, like you really did make some good choices for the long term.
Well, you didn't have children back then either, right?
And I
Right.
didn't want children at all.
Yeah.
Rocky wanted children. I wanted horses. He said no horses. I said no kids. And we said, okay, cool. And then I watched people in the hospital that didn't have children dying alone or having some niece or
Mhm.
nephew that would come in, but it'd be really inconvenient for them. And I'm like, gosh, I need to make butt wipers. Uh,
Mhm.
I need that person, like you gotta have kids.
Yeah.
So when I told Ronnie I wanted to have kids, he was like, "Ha, ha, ha," and I'm like, "No, like I think we got to do this." And he was like, "No horses."
Not giving in to that. And God knows, and God knows more than we do what our future holds. And so I love that you were able to take a step back and say, no, this is where God's got me. I did the same thing when Eddie and I got together. So when Becca's brother and I got divorced, I was finishing up my bachelor's degree and was going to law school. And I had gone to Tulsa University. I had gone. They took me on the campus. I was getting my room set up. I was getting everything ready to go to law school. And during this time, Eddie and I were talking as friends, right? And then, long story short, things happened. We became more than friends. And I still was like, what about this law school thing, right? This has always been my dream, right? This was the plan. And so we ended up getting married. I moved to Utah. That's where he was stationed. He was in the Air Force at the time. And I says, well, I'll just go to night school. I'll just go to University of Utah. They have a great legal program. Well, they didn't have night classes. They says, no, 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 you have to come during the day. And at the time, we were still pretty young. We were in our late 20s, and I needed to work. And so I had to make that decision too. It's like, okay, I had to put aside my dream, right, of becoming a lawyer. I wanted to be a prosecutor in the special victims area. And what I ended up doing was kind of combining my HR background and my passion for law, and I kind of got into labor relations and stuff like that. I was able to use both, and during that time, I was doing some investigations, and I had to investigate a very disturbing case with the what did you call it? The special investigators on base. And it was at that moment that it hit me that this is what I wanted to do for a living. I wanted to be involved with this special victim stuff. And that affected me so badly that I needed to get some counseling
Oh
because I
wow.
couldn't handle what I had seen and what I was learning about this case. And that was just God saving me from that,
Mhm.
right? I thought at the time, I'm like, oh my gosh, I gave up my dream to get married, which I don't regret, you know, but hindsight, if that would have been the career field that I'd have chosen, I may not have been able to handle it well, you know?
Right.
So, Everything happens for a reason, right?
Yep.
Absolutely.
It's true.
Yep.
It's like, speaking of, I know we want to talk about what Misty does. So everything happens for a reason. So I know you and I have talked about me and my Botox like in our
Mm-hmm.
podcast before. And I think the last one we recorded, I said I wasn't going to do it anymore because we were talking about the bangs. Like I'll just grow out some bangs. And,
It didn't work
and
out.
then I was like trying to budget and I decided I wasn't going to do it. And then I was back here in Oklahoma and I was like, okay, I'm going to see Misty. But anyway, so I am doing that again with her. But previously when I went to her the first time, which was what, 5 years ago, maybe 6 years ago, she probably doesn't remember. I think 5 or 6 years ago. And she had discovered a spot on my face that she said was precancer. And so I often think that Misty truly saved me because I
Mhm.
went to a dermatologist. She told me to go to a dermatologist on because I have a TRICARE, to go get a referral. And I did. And that doctor said, "Oh, it's nothing." He was the worst. And he said, "Oh, it's nothing." And I said, "Well, I trust my cousin's wife 100%." And she was really telling me I really needed to go do this and get this checked out. And so he said, and his exact words were, "Well, okay, well, if you want me to just cut on your face for no reason, I'll do it." And he said, "But I really think you're being a hypochondriac." And so I was like, "Well,
Oh
I don't
my
care,
goodness.
do it." And I don't usually stand up for myself like that with doctors. I usually don't. But because I trust Misty so much, I did. So he called me when the results came back and he was actually crying on the phone, apologizing to me. And he said it came back positive. And I mean, thankfully it was a basal cell carcinoma, but still he was crying because he said, "I didn't listen to you. And I feel like a terrible doctor today. And I want to thank you for pushing me. And please always push in the doctor's office. Please always push for what you really truly believe in, because I would have never done this. I would have never done it had you not pushed me." So I feel like I owe Misty for finding that and letting me get the care that I needed for that before it got out of hand, before it got out of control, like Viv, like what happened with you.
Mhm.
So
Yeah, so there's places on your face that if you get something that looks like a little pearl, that you want to get looked at. So the areas right outside your eye, which oftentimes those are just calcium, but you've got to get them looked at. Right
mhm,
here at the inside of your nose, these are common places that people allow a little pearl, assuming that it's like a gland that's obstructed or something, and they let it grow. But that's where basal cells like to be.
mhm,
And the earlier you find them, the less tissue we have to take.
mhm.
And so you want to find them early. You don't.
Yeah,
And
right.
they actually tell us that if you don't get normal biopsies back, you're not biopsying enough tissues, right? Because you should be more concerned that you miss a cancer than you are that you take something off somebody. So like
Mm,
a scar is a scar and it's not
yeah,
fun, but if it's done well, it shouldn't be a bad scar for a
yeah,
biopsy. The scar should be minimal to the sense of reassurance that you have that it wasn't cancer
mhm,
or the fact that you caught it early and don't have
Yeah.
to do bigger things.
yeah. Well, and mine was right here too. So, I mean,
Mhm.
I could have had, I mean, they told me like when they said they were going to, they did the topical chemo and they said if they had to do the Mohs, if they decided to do that, they'd have to just keep going deeper and deeper. And he even said like we would have to have a plastic surgeon on hand to be prepared to correct this. And so that on my face right there, that's why another reason I was so pushy about it, other than the fact that I trusted you, because I just kept thinking like, I could be completely different
Yeah.
if we have to go too
So
deep
so
and
Mohs, that's something that like most people aren't going to know what that is. So let's just tell your listeners what
yeah.
that is. So Mohs is a special type of surgery. It's a dermatologist that does additional training and actually looking at the pathology. And so what they do is they take what they can see and then they just cover you up and go out of the room and process the sample and look at the sample. And they say, okay, from 12 o'clock to 2 o'clock, I don't have enough normal tissue. So what we know is that we have to get a certain amount of normal tissue to make sure that there's no micro invasions that are going to cause a reoccurrence. And so they go out, look at the pathology, say, okay, from 12 o'clock to 2 o'clock, I need to take more. So they come back in, they take a little bit of tissue from 12 o'clock to 2 o'clock, and they repeat that process as many times as they need to get the margins that we need for the specific type of lesion. And so it's a one and done kind of procedure. It's really nice. And it's really been, I mean, I don't really know the time frame, but it's become more popular in the last 15 years. And there's more Mohs surgeons than there were before. It used to be like one in the Oklahoma City area. Um, and so then they almost always have a plastic surgeon friend, and it's very alarming to patients. Oftentimes
Yeah.
they leave the office with a big hole in their face. And the
Mhm.
next morning they go to a plastic surgeon. And the things that they can do, it's remarkable. Like you think,
Mhm.
I'm going to be maimed, I'm not going to look good. It
Yeah.
is just magical and remarkable the things you can do. So don't be panicked if you're somebody that goes out and you get a biopsy and somebody says, we're going to have to do this and you're going to have plastic surgery. Because I'll tell you, there are a lot of people that end up coming out looking like they got a little facelift. And
Oh.
so it's not all
Ooh.
together. It just hurts your heart and your
Yeah.
emotions. It stabs you is a sense of mortality. Like all of a sudden you've got this thing that starts to see that you never wanted to hear said to you. But that's what Mohs is, and it is a really great, fast way to get everything taken care of.
So I want to just, if I can, go back to what Becca just said because this happened to me too. And that is standing up for yourself in the doctor's office. And as a doctor yourself, Misty, I'd love to get your feedback on this. But for me, y'all know, I had melanoma, and it was in my leg, my shin on my left leg, and I had a spot there that was there. I noticed it 2 years before they actually determined that it was melanoma, and it was kind of like this little blue spot, and it just kind of was like the size of an eraser head, and it just showed up one day. And so, because I'm fair skinned, my dad has skin cancer, I go to the dermatologist often, and I went, and she looked at it and she said, it's nothing, just watch it. And so I watched it, and I didn't get back to the dermatologist for 2 years. That's kind of my bad. By the time I'd gotten back, she was gone and another dermatologist was there. And the reason why I went was because I had a spot right here on the middle of my nose. And that's what prompted me to go. Because anytime something's on your face, you're like, oh no, I got to go get that
Mhm.
checked out. And again, talk about God's divine intervention, because I'd had that spot on my shin for 2 years, and this showed up, and that's what got me to go in. And he looked at it and he says, that's fine. It's just a capillary. Let's do a full body though, since you're here, because you paid your copay. Let's just, get you your money's worth. And then when he looked at that spot down there, he's like, we're going to biopsy this right now. And so he did. And long story short, I got a call 2 days later that says, we're referring you to Huntsman Cancer Institute. You have melanoma. And at the time, they staged it as 3/4. And I was like, how can this be? And he's like, it wasn't growing on the top, it was growing down and out like octopus tentacles. And
Mm.
so they were very concerned that it had already metastasized and spread. Going back to that, it's nothing, don't worry about it. I'd like to talk a little bit about standing up for ourselves, and when should we um get second opinions, Misty?
I mean, anytime you have discomfort, I mean, really, anytime you have discomfort, I think there are a lot of doctors that maybe get offended. It hurts their egos, but it's an ego. Who cares? So if you have concern, a second opinion is not a bad thing. Now, I tell people two opinions can be polarizing, and so then who do you believe?
Yeah.
So
Right.
second opinions often beget a third opinion, and then you have to
Hmm.
decide which one of the two similar ones do you go with. Do you go with your
Hmm.
first try that you questioned and have you broke that relationship, or do you go with the next? But I think that anytime you have concern, you need to be like, this really bothers me. Do you mind relooking at it? Can we try? And if you're not heard, then go for a second opinion. I wouldn't break that relationship and be like, well, I don't believe you. You can say, okay, well, thank you. I'll follow up. And
Yeah.
then they don't need to know that you went for the second opinion because it hurts their feelings sometimes. And
Yeah.
even in moments where maybe I've had a moment where I'm like, well, why didn't they trust me? I'm like, I'm a human. Like,
Mm.
first and foremost, I'm a
Right.
human. I have my knowledge, and my knowledge is affected by my background and the things I've already seen. So there are things that I haven't seen that somebody else has seen. So a fresh set of eyes isn't always a bad thing. I think when we're colleagues and we're able to discuss, okay, this is why I feel, it helps us all grow. But I think you need to advocate for yourself, and a second opinion, if done in a good heartedness and not like, well, you're dumb, I'm going to go somewhere else. And then you hear something polarizing. it doesn't necessarily mean that guy was wrong. It means
Right.
this guy has a different thought, and then you need to figure out where the numbers line.
Well, thank you for that, Misty, for that permission for us to feel
Yeah.
comfortable and confident in getting, a second opinion. So I wanted to talk just a little bit because you've got a direct health clinic. And so I wasn't quite sure what that was when I first was kind of looking into your background. Can you explain what that is and how's it different than like your other clinics?
Sure. So there are lots of kind of ways that doctors are moving out of the corporate world and being forced by insurance companies to do things. And so there are lots. So direct primary care, the heart of direct primary care is taking the insurance power away. So I no longer have to check boxes just because the insurance company gets paid better or reimbursed by Medicare better because I checked a box that's really not applicable to that patient. So unfortunately, as more and more less educated people are practicing medicine, medicine is turned into an algorithm based practice. And so that algorithm based practice doesn't take in the individuality of the patient sitting before you. It doesn't take in that relationship and the understanding of all the background of that patient. It's check boxes and it's very impersonal. Um, so direct primary care basically is paying an office a retainer fee so that that doctor is your doctor. That allows that doctor to not have to have a panel of 1,500 like I had at my previous practice. So
Mhm.
taking care of and be responsible for the health and prevention of 1,500 people is a lot. It's a lot. So basically direct primary care is you're paying a retainer fee and it ranges. I have mine relatively inexpensive because my goal is not to get rich, is to have quality of life and quality of care for my patients. So ranging anywhere from 75 to $200 a month, depending on where you're located, is the price going for direct primary care. And you pay that fee and usually have direct access to the doctor. So my patients had direct access to me through an app called Spruce. And they basically text me and I can take what they put on Spruce and decide if it goes into their medical record or not. So if they randomly want to show me a picture of their new puppy because we had to talk about dogs last week, I'll put that in their medical record. But it's there, right? So so basically, I have set my practice goals to around 400. I'm about there. Um, and so it's 400 people. I can manage that a little bit easier. And they pay a monthly fee. And the things in the office that I do are covered. And so there are some things based, and there's a contract at the beginning where I'm very like open about cost. So if you get labs drawn, you can choose to send your labs with your insurance information, and the lab can bill your insurance. And then you end up with a copay. But that
Oh,
copay often is more than the actual lab cost. So I've negotiated costs through the labs. So it's crazy inexpensive, crazy. So
Yeah.
what used to cost like $700 or $800 to my patients for a wellness panel, if you will, like basic stuff, really only costs about $30.
Oh,
wow.
Yeah,
wow.
yeah. So
Wow.
people that have copays more than $30 or so for their labs, I tell them, we can send it with your lab. This is what it would cost at my cost. And so I give them my cost. I like round it up to the nearest dollar for round numbers, but definitely I'm not making money on that. Um,
Mhm.
this is what it would cost at my cost. And so if your copay is more than this, from now on, we know that we send it as my cost and you just pay that cash amount. Currently, the system is starting to move towards understanding that this saves them money too. But the reality is your healthcare costs are guided by insurance companies and CEOs. And those CEOs, whether in hospital systems and laboratory systems or in insurance companies, are guiding those. And so hospitals will send you a bill for a ridiculous amount and say, we filed this with your insurance. Your insurance is only going to pay this amount, and we're going to write off this amount.
Mhm.
This is usually considered charity, depending on how the hospital system is read up. So it helps them on their taxes too to inflate the cost of healthcare, right?
Mhm.
So that the inflated cost of healthcare isn't real. It's padding pockets of people in suits and offices that aren't doing the real work and interactions with patients. And
Mhm.
so this direct primary care is taking that middleman out and saying, listen, these are the costs. I have in Oklahoma, doctors can dispense from office. So I have a dispensing pharmacy where I don't have anything controlled or anything that anybody want to break in the place for. But What I found is my older patients were paying about $15 a month for their blood pressure medicine that costs 97 cents for a 90-day supply.
Wow.
So for a lot of
Wow.
my patients, if they're on just a few medications, I can save them enough that it almost saves them the amount that is their membership fee.
Mhm.
Wow.
Mhm.
Paying for like advanced imaging. If you go get a CT or an MRI, your copay is $700, $800. No, anywhere from $250 to $400 is what they cost. And so most
Wow, I didn't know any of this.
and you
Yeah.
get it
Mhm.
extra because we don't have to deal with the insurance company.
Yeah.
Yeah. Wow.
There's
Gosh,
a
Becca, I don't know about you, but wow, that I'm thinking of I've had a lot of doctor's appointments over the last 3 years with my cancer journey and all the things, and yeah, that is what a beautiful service that you're providing. Thank you for
Yes.
doing this.
so there's another I do people get it confused with concierge, and I'll tell you that is it's not the same. Concierge medicine is a doctor that's established themselves and feels that they have enough value that people should pay them extra. And they are taking that membership fee and also billing your insurance.
Oh.
Oh.
So I just wanted to clarify, like,
Mhm.
primary
Mhm.
care is very different than concierge medicine.
Mm.
Got it. So you also have Imogen Soul, correct? And Becca, that's where you've been,
Mhm.
right? Okay, let me
Yep.
hear about Imogen Soul because I don't live in Oklahoma anymore, y'all. I feel like I'm missing out. So tell me about it so that I can come when I visit next time.
Imogen Soul is I opened in 2014. It's a cosmetic clinic and spa. So there's a massage therapist, there's estheticians that do facials. Um, we've had periodically micropigmentology, which is the tattooing of brows and liner and lipstick, that
Oh.
sort of thing
Mhm.
as well. And then historically, until a year and a half ago, I would just come in a day and a half and do injectables and laser treatments. So laser hair removal, which, honestly, I sat back and I was like, I love procedures. And how can I own a laser so I don't ever have to shave again?
Okay.
Uh,
Mhm.
Amen.
so, um, so yeah, so I come in and do Botox, botulism toxins, and so I'm going to clarify that just for the legalities of it. Botox is a trade name of one of the 4 approved botulism toxins on the market. And I do use Botox, but I actually often use the others. And so I'm just going to make sure that everybody's aware. I'm going to use the term toxin from now on.
Oh, okay.
So we do toxin, and toxin paralyzes muscles, so you can't make motion because when you make motion or contract muscle, your skin has to go somewhere. And over time, your skin will crease, and that's what a wrinkle is. And so your creasing occurs in weak spots, sometimes over blood vessels or your lymphatic drainage or just wherever it decided to crease. So by paralyzing the muscle, you stop the contraction and allow the crease to try to plane out. The deeper the crease, the less likely Botox is going to fix it. So Botox is usually more of a prevention than a cure of wrinkles. So you don't want to wait until you have a deep
Uh-oh.
crease that you wake up with in the mornings. You want to start doing it when you see a crease setting in by the end of the day, but it's not there in the morning.
Mm.
Okay.
Mm.
So if you form a crease throughout the day, you are developing what's called a static wrinkle. And a static wrinkle, there's no guarantee Botox will get rid of it or toxin will get rid of it. And so basically, it's paralyzing muscle. I do my face in round, which is not not totally common, but I will do my forehead. And then 2 or 3 months later, I'll do my crow's feet, or 2 or 3 months later, I'll do this. That way, I have motion, I have expression, I have warmth in my face. I'm not the newscaster.
Yeah.
So that's how I prefer to do it. I like more of a natural look by paralyzing those muscles for a period of time, you learn to stop making the face. And although like my forehead doesn't
Oh.
have the Botox in it
Mhm.
or toxin in it right now, I don't make that face often enough to form a wrinkle
Mm.
Oh my
because I've learned not
gosh.
to use those muscles. So I do a lot of that. That is the most common procedure that I do. It's a quick procedure. Side effects, there are side effects, and the things listed on the drug are extensive and scary. But
That's
most
why
of
I haven't done it. I'm scared.
I don't read them. I just don't read it.
Becca's like, just do it. I don't care.
Accept. I just click accept. That was a
uh,
question I was going to actually ask you because my daughter and daughter-in-law are 26 and they wanted to know both of them if they should start now. And I'm like, I don't know. They keep reading, it's preventative. So start young. But if you're saying you can become immune to it, then they definitely don't want to start too
And I
young.
don't know data wise, like who and how or why those specific people become immune. But so yeah, I would say if you're 26 and you have a good skincare regimen and you're staying well hydrated, you should have more collagen production than breakdown.
Yeah.
And so you shouldn't have a line at the end of the day. You may, I had very, very ferocious wrinkles, and I've actually looked at my 13-year-old daughter. She already has a line right here. So we just have strong foreheads. Uh, so I mean, it would just depend on the person. That's why you
Yeah.
usually discourage the very young ladies, or I tell them once a year, very low dose. The recs come in from the toxin companies and they say never underdose, always do at least this amount. I'm like, no, no, no.
Yeah.
Each person's muscle is a different strength. Each person's needs a different strength. It's a very tailored procedure.
Mhm.
Yeah, so Botox is a non-reversible, non-permanent fix, right?
Okay.
So it is going to reverse itself over time and you'll regain your strength over time, which on average is 3 months.
Mm.
So I tell people 3 months to FDA actually means 2 to 5. And
Mm.
sometimes your injections are going to last 2 and sometimes they're going to last 5. My gut, based on experience and myself, is that the more metabolically active and hot I am, meaning like I trained for a half marathon a couple of years back, it was 2 months every time. Like it just did not last.
Oh.
Mm.
My girls that do hot yoga, it just doesn't last as long. And so the more metabolically active or exposed to heat you are, the less it seems to last. But in general, it lasts at least 3 months, but then we'll just plane off and you'll regain strength. So coming to Oklahoma once every 2 or 3 years, probably you need to make a relationship where you're at.
I do. I do. Hey, so don't judge me, okay? This is a question I got to ask. So if it's does something with heat,
I know what you're asking.
okay, I'm a lady of the 50s,
Yeah.
okay? And I got some heat issues happening. That kind of heat gonna mess up my Botox?
I like to call those power surges.
Power surges. I am really
She's
So
very
surging.
you're having
powerful.
I'm very
Very
powerful.
powerful. Me too.
yes, me too. I'm with you on the power surge world. So I don't know. I guess because my theory on heat is based on, me training and seeing these girls over and over that when they're really intense doing hot yoga, it seems like they
Right.
want to come back before the 3 months, and I will not inject before the 3 months. Um, so I guess I just don't know the answer to that.
Well, I don't either.
Logically it may affect it, but
Yeah.
those surges aren't. They're so full body and so quick. I would think probably not.
Yeah. Do you want to know what my husband does? Y'all, he's really embracing this season of my life and he's having a good time with it.
Okay.
And which, whatever. He has out in the garage, he has this heat gun thing that he does something with his motor. I don't know, with his engine. And
Misty
he
probably
comes
knows.
in, Missy probably knows what this gun thing is. He comes in from the garage and he's like, "Hey, I was just wondering, when you're flashing, if I was to put this thing up to your forehead, would your temperature spike? Is your temperature going up?" And I said, "I don't know." So I'm sitting there, we're watching TV, and I look over, I go, "I'm fixing a flash." He grabs his little heat gun thing, he sticks it up to my forehead, and it didn't show that I was like 1,000 degrees. And I'm like, I totally feel like I'm 1,000 degrees right now, and I'm sweating. But the little heat gun thing said like 94 degrees, perfect. So I don't know.
So my first hot flash, I was in Walmart of all places. And I hate to be cold. Like it hurts in my bones. I hate to be cold. So I'm in Walmart and it's kind of a rainy day outside. And I'm at the checkout line, waiting in line. And I was like, what's a weird feeling? And then it's like, "Ooh." And like you're sweating in the back of your neck. And I'm like, I'm having a hot flash.
Mm-hmm.
I kind of like it.
Because
She's ready to be cold.
Well, I
Oh,
don't know about
gosh.
y'all, but it's the weirdest thing for me. I feel like I'm fluttering inside. I'm fluttering, and it starts with my arms. It's the weirdest thing. My arms start to feel fluttery. I feel fluttery in my chest, and then it just goes up, and then I start sweating. And yeah, and it happens mostly at night, which is really getting on my nerves because, it messes with your sleep.
Like,
Mhm.
you learn to like sleep in layers and have an extra blanket. Like Ronnie laughs because it's all of a sudden like you're on a blanket. You're like,
Yes.
Yep.
Yes. Yes. There has been a couple of times, this is TMI, but I've woken up and I didn't have no clothes on. And I look at Eddie, I'm like, what'd you do? And he's like, I didn't do anything. It was all you. And I'm all like, okay, I don't remember this, but my clothes are just strung everywhere and I am butt naked and still hot. So I don't know what to do.
I'll wake up sometimes or I'll go to bed with the socks on and pants because I'm cold. But then in the middle of the night, I have a hot flash. So I'll wake up with one sock off and one leg out of my pants. And I'm just sleeping like that. And I'm perfectly fine because half my body's covered, the other half isn't. But I'm aware of it when I'm
that
doing it.
leg, one leg out.
Yeah, one leg out, but my whole leg is out of my pants. So
Okay.
now, speaking of black cohosh, I was told once, and it wasn't by Misty, it was by someone else, that because my mom had a history of breast cancer, that I should never, ever use black cohosh. Do you agree with that? Or is that, you don't have, I mean, I don't know. What do you think?
No, so the black cohosh doesn't have the phytoestrogen, so that one I don't get as worried about. But any estrogen, phytoestrogen, I would be more concerned
Yeah.
about. Um,
Yeah.
but there are other things that you can do for hot flashes that are prescription based. They're actually usually side effects of medicines. So some of the antidepressants work well for hot flashes if that's your main concern, as well as sleep. So there are a lot of other meds that are used for other things that help women with their menopausal
Yeah.
symptoms. So if you can't take hormones, it doesn't mean that there's not options for you. But I'll tell you that if you can get through menopause without the hormones, you should.
Mm-hmm. Mm-hmm.
And if you go to a place that's going to do labs on you and tell you your labs are terrible, you need to make sure that you look up the time those labs should be drawn, because a lot of these hormone clinics will draw your labs midday and then tell you, oh my gosh, you're so low. Well, there's during the day normal fluctuations, and there
Yeah.
are standard times that you're supposed to check those things. And if you're not checking at the standard time, it's always going to look bad. And we
Mhm.
don't treat lab values. So if your hormone doctor is treating your lab value, they're in it for the money. They're putting a pellet in you that they're making some money off of or something, because we treat symptoms. We don't treat
Mhm.
values.
Mhm. That's really good advice. That is
Yeah,
so
it
good.
is.
One last question before we start wrapping things up. And I'm wondering, how long is this menopause thing going to last? I talked to a friend of mine a couple weeks ago, and she was like, Vivian, once you get through it, it's smooth sailing. The weight will come off. Life is going to be great again. And I'm like, okay, when? When might that be?
I think everybody's different. It's just like almost
Oh.
like mamas of newborns. Some are like, my baby slept through the night from the first day. And you're like, oh. Uh,
No, I don't like you.
so there are these people that just fell through it and they're like, I don't know when it happened. It just went away. And you're like,
Mm,
uh. So they're
wow.
going to have no idea when it actually happened. By definition, it's 12 months with no menstruation,
Right.
and or some symptoms without some sort of intervention, ablation of your uterus, hormones, those sort of things. So no intervention, 12 months, no period is your medical definition. And menopause. The symptoms of perimenopause and menopause have a variation of how long they're going to last in each person. So I have no good answer for you.
Thank you so much, Dr. Bogle, for joining us today. We have learned so much. I don't know about you, Becca, but I
I
just learned
have.
about 5 different things
Yeah,
today.
it's been great. Thank you.
Thank you so much for joining us. Till next time.
Bye.
Thank you for joining us for another special segment of Sister Talk with Viv and Becca. We hope you enjoyed today's conversation with Dr. Misty Bogle. Before you go, please make sure to like and subscribe and let us know if you've enjoyed today's show. And remember to visit me at my website, viviancummins.com, where you can grab your free Restoring Balance study guide and more information that will help you move that needle from busy to balanced. Until next time, be blessed and stay balanced.